Hi, folks. Good afternoon. I know this is post-lunch, and we are starting a little bit late because I think lunch ran a little longer. So thank you for coming. And my name is Raghu Vardarajan. I'm a surgeon, but I'm going to be chairing this session. And the speaker is Dr. Terence Ong. And just to introduce Dr. Ong, he's a consultant geriatrician and medical lecturer at University Malaya. And a visiting associate professor at the School of Medicine at Taylor's University. And he completed his, I was just talking to him now, and he had completed his specialist in research training in Nottingham, University Hospitals and University of Nottingham, and his interest really is in improving musculoskeletal health and fragility fracture treatment amongst older people. Dr. Ong also serves on the committee of the Malaysian Osteoporosis Society Asia Pacific Panel for International Society for Clinical Densitometry, Fragility Fracture Network Malaysia, and the Asian Working Group for Cachexia. So that's a wide range of experience, Dr. Ong. He currently serves on the editorial board for Age and Aging and the Medical Journal of Malaysia. So without any further delay, can I welcome you, Dr. Ong, and we look forward to hearing your talk. Thank you very much. And before we start, can I just remind everybody to put your phones on silent, please? Okay, thank you very much. Appreciate it.
All right. Hello, everybody. Let me just get this mic slightly adjusted so I don't have to lean into it. I mean, the first thing I was going to say is hello, everybody, and those watching online, hello. It's a bit different because this is my actual first physical conference. It's different to actually talk to people instead of a camera screen. So it's a really interesting experience for me today. So I got to thank the organizers and Abbat as well for the invitation to speak to you today. So today we're going to talk about, let's see if we get the slides up. There we go. Looking at how muscle, specifically protein, interacts. So to talk about muscle, one has to understand how muscle changes as we age. Okay, so there's a life course approach to how we approach muscle. And this is something that we come up quite a lot when we look at journals and papers that talk about muscle over the course of the age. We all start more or less at a very similar point in time, and as we grow older, there is this divergence in the way our muscles change. Okay, so when we are young, we all build muscle. Muscle gets bigger, it gets stronger. We run faster, we jump higher. Things get better. But it does come to a point where things, unfortunately, inevitably, does start to decline. But what's interesting about this decline, this trajectory, is the divergence and how much it diverges, changes, differences from individual to individual. Which is why, if you think about it, you can see 70-year-olds who are pretty fit. They can do 18 holes of golf, no problem. And you've got some who are a bit more dependent. You've got some who are massively dependent. Okay? So there's huge heterogeneity in the way our muscles age as we get older. And we've seen this replicated in population studies. So this is, So this is a study that's based in the UK. So what they did was, there were about 12 studies in total that look at how strong your grip is. Okay? So they got a lot of people to just get on these grippy things called a dynamometer, and you just grip as hard as you can across different ages. And you can see this very much reflects the figure I showed earlier, where you get muscle strength that increases as we get a bit older, and then you get this inflection point around 40 years old. So you can sort of know where you are now in this age, around the 40, where things do start to decline. And again, that how big that decline is can be quite significant. Some decline more, some decline less. Okay, but around 40. And it's predicted that this skeletal muscle mass that declines about 0.5 to 1% every year from the age of 40 onwards. Now, two things to remember. Optimal muscle health through life is very basically determined on two things. The first is whether we attain our peak muscle health as we're growing. Okay? If you hit that, you've got a better chance of maintaining that level of muscle function over the course of your life. If you don't hit that well, you're going to start at a much lower level. And the second bit that predicts our muscle trajectory is this, the speed of decline. Okay? And when you decline enough, lower and lower and lower, you're going to pass an arbitrary threshold. Okay? And once you pass this threshold, we develop a condition called sarcopenia. Okay? Sarcopenia is very popular these days. It's very sexy. There's a huge literature around it. But essentially, if you pass this arbitrary threshold, and we'll talk about this threshold in a little while, one becomes sarcopenic. Okay. So there are factors, there are risk factors, there are associated factors that do drive this decline in our muscle trajectory. And I've listed some of the modifiable ones. Now, we can't do much about getting older. We can't do much about ethnicity. We can't do much about our gender. But what we could do about is some of these things, which we know play a very big part in how quickly we decline in terms of our muscle function. Welcome, there's seats at the front. Malnutrition, obesity, chronic illness, acute health issues, and physical inactivity. These are all drivers that accelerate muscle decline. So let's talk a bit about sarcopenia. I've introduced the term already. Let's explore it a little bit further. Okay, because when we talk about nutrition later on, it's very much to try and treat this particular condition. Okay, so this is the definition. It's a progressive skeletal muscle disorder that involves accelerated loss of muscle mass and function that is associated with increased adverse outcomes. So let me draw your attention to a few key points in this definition. First one is it's progressive. Progressive in the sense that if you did nothing about it, it gets worse. Second thing, it's loss of muscle mass and it's loss of muscle function, which means what you can do with your muscle declines as well. You run slower, you don't jump as high, things take longer for you to do it. But the key bit, the third thing I want to draw your attention to in this definition is that each of these problems is associated with an increased adverse outcome. Okay? Bad things happen if your muscles don't work very well. Okay? Now, so there is an ICD-10 criteria for sarcopenia. Okay? What this means is it is a diagnosis, it's a disease, okay? You can label it. Similar to how you can label cancers, heart disease, strokes, high blood pressure, diabetes. You have sarcopenia is recognized as a disease. It's got an ICD code. What it also has is the means of defining it. So when we talk about muscle health, when we talk about sarcopenia, we more or less refer to three things. Its mass, how big it is, its strength, how strong it is, and its performance, how well and how much you can do with it. And we think of sarcopenia as a progression of muscle disorder. You've got this little spectrum at the top of my slide here, where you've got someone who has got no sarcopenia, you've got this juicy thigh muscle there, and all the way to a severe form of sarcopenia where you've got all this shrinkage of muscle. Okay? And what clever people, what clinical experts have tried to do is try and define at which point of that trajectory, at which point of that threshold, one becomes sarcopenic. There's a European version to this, there's an American version to this, and the one that I'm alluding to is this one proposed by the Asian Working Group for Sarcopenia, okay? Which uses specific tools, specific equipment that define certain threshold, and if you pass these threshold, you'll be considered sarcopenic. But what you can see with some of these tools and measurements is that they're not always the most accessible bit of equipment, not always the most accessible piece of kit. We talk about measuring muscle mass, but how many of us have access to whole body DEXAs, for instance, or a BIA machine, okay, or access to dynamometers that can assess muscle strength? So a lot of the ways we can pick up sarcopenia can be challenging, can be inaccessible unless you work in centers that are geared towards it. Which is why before we even talk about doing something about it, We need to be able to think of how can we identify if you, I, or the people we come into contact with have a problem with their muscle health. Can we do any form of self-assessment to see, oh gosh, have I got a problem or not? Okay? And there's some very simple ways. The first one is just do what we call a simple sit-stand assessment. You cross your arms, you stand up. And you do it as fast as you can 5 times. And if it takes you longer than 12 seconds, that's slow. You can do it where you are now, sat in front of this conference. You can do it where you are now, sat at home watching this video. Other ways of self-assessment, but one that's quite validated is by measuring of calf circumference. Okay? So the meatiest, juiciest part of your calf, you measure its circumference, and if you are lower than these thresholds I've got on the screen, chances are muscle mass overall not so good. So we're using calf circumference as a surrogate marker of an individual's muscle health. Doctor, I don't have access to a measuring tape. Well, the Japanese came up with this finger ring test. Dead easy. Just do this. Make a ring with your index finger and your thumb, and you see whether this is bigger or smaller than your calf circumference. You can do it now. And that gives you an idea. Remember, these are all surrogate markers of your individual muscle health. Not diagnostic, it gives you an idea. And that's what we need to push, is if you don't even know what's going on, then how are we going to do something about it? So I was asked when I did a talk similar to this not long ago, Doctor, can I go and buy some of this equipment now? If you go onto the internet, you go on some of these e-commerce websites, you can buy kits like this. Okay? Now, first thing to say is they are not medical equipment. They are marketed as lifestyle products, perhaps health products. They are not diagnostic. But if you want to purchase one of these, you want to try them out, by all means. It does give a pretty good indicator of what might be going on for you to take the next step. Okay? It may give you an indicator of what you or the people you come into contact with, your patients for instance, of what their muscle health is doing, so that you can do something about it. But if you want to look at perhaps the most recognized method of screening your risk or anybody's risk of sarcopenia, is a SARC-F questionnaire. And you can just Google this, SARC-F questionnaire. It's got 5 questions. You get a score depending on how you answer it, and a score of 4 or more indicates that you probably got a degree of muscle impairment. Remember, it's a screening assessment. It's not diagnostic, but it's a good starting point. Okay? Now, just one slide to summarize the importance of picking sarcopenia up. It's common. Okay? And depending on which study you want to pick up, depending on which study you want to quote, but we know among community dwellers, adult community dwellers, it's about 10%. 1 in 10, okay? How many of us are in this room at the moment? Okay? Chances are a handful of us may potentially have something not just quite right with our muscle. Okay? It's common. And this prevalence goes up even further when you look at very specific cohorts of people. The older ones, the ones who live in care homes, the ones who've got chronic illnesses, okay? That prevalence increases. So I've a particular interest in sarcopenia that develops in hospital. So I know that if I were to do sarcopenic assessments on my hospital cohort, about 25% of them probably will have sarcopenia. Okay? 1 in 4. As I've mentioned earlier on, any outcome you can think of, okay, any outcome you can think of, whether it be mortality, survival, functional decline, having impairment of your muscle does not help. Okay? But the most important part to this slide is it's something that we can do something about. It's a condition that is manageable. Okay? And we're going to look at one aspect of its management. Okay? Alright, a quick time check. Now, so let's talk about nutrition in older age. Now, we know that if you eat well, you feel well, you're going to be physically better. The same goes for muscle. Okay? If you eat well, the muscle will be better. Okay? It's not rocket science. Okay? This is not groundbreaking information. But we also know that the older we get, the harder it is to consume the necessary nutritional requirement to maintain what is required to keep you going. In this case, we talk about muscle, the requirements to maintain optimal muscle health. Okay? So, this is numbers that's derived from European observational studies. So, in European cohorts, they estimate that about 10% of community dwellers and about just over a third of care home residents probably don't eat enough protein. Why have I highlighted protein? Okay, because protein is a massively important nutrient when we talk about muscle health. Okay, so the muscle isn't a static organ. Okay, muscle undergoes constant turnover. You have muscle protein synthesis, where new muscle is being developed, and then you've got muscle protein breakdown, where old muscle is destroyed. Okay, and over life we get this cycle of new muscle replacing old broken muscle. When we're younger, obviously muscle protein synthesis trumps muscle protein breakdown. As we get older, the balance tips the other way. We have a lot more muscle protein breakdown compared to muscle protein synthesis. Okay? And it's this rate of turnover that determines muscle health. So every form of nutrition or any treatment for sarcopenia aims to increase muscle protein synthesis and reduce muscle protein breakdown. Now, and the prerequisite for muscle protein synthesis is protein. And that's why protein becomes very, very important. How much protein do we need? Okay? Now, this recommendation is fairly consistent. If you look at our Ministry of Health's RNI report, the recommended nutritional intake, 2017, excuse me, which was the last report that came up, it very much echoes what's been recommended in other parts of the world. So, an adult would need, 0.8 to 1 gram of body, 0.8 to 1 gram of protein per body weight per day. So if you're a 60 kilogram individual, that's 60 grams of protein every day. And you can do the maths. An older adult is gonna need a bit more. You're gonna need 1 to 1.5 grams of protein per body weight kilogram per day. So if you're a 60 kilogram individual, that's 90 grams of protein a day. Okay? Why do older people need more and not less? Well, older adults have a degree of what we call anabolic resistance, okay? Where they're gonna need a lot more nutrients to generate that same degree of muscle protein synthesis, okay? Being ill, having chronic illnesses creates an inflammatory response within the body, which makes worse this anabolic resistance. Being inactive, being sedentary, actually accelerates muscle breakdown. And there are various factors. But putting them all together, actually being an older person, you're gonna need a lot more protein than you would have had needed in your younger days. Now, and I think in the interest of time, because it'd be nice to take some questions at the end of this. This was an interesting study, okay, that was done in Singapore. Because we sort of talk about not eating enough, not taking enough protein as perhaps an indicator of malnutrition. So this cross-sectional study in Singapore, very simple. They recruited about 400 robust older people. So they had posters, they had leaflets, so they're just robust older adults, okay? Of a mean age of about 70 years old. They were not at risk of malnutrition. They've got a good body weight. And then they were all put through something called a BIA, which is a tool that we use to measure muscle mass. And about 20% of them, so 1 in 5 of them, had muscle mass that was lower than the threshold that was set by the Asian Working Group for Sarcopenia. Remember? Robust, healthy older adults. Okay? 1 in 5 had low muscle mass. Okay? And this low muscle mass were associated with increasing age, female, smaller calf circumference, a lower BMI, and being less active. So it's not necessarily low protein intake being a problem of someone's got malnutrition. It can be a highly prevalent condition even in healthy, not malnourished adults. So looking for them becomes the first step in addressing the problem. Now, this interesting study looked at whether how much protein we consume affects our muscle mass. Okay? So it's based in the States. They had about 2,700 people, and it was very simple, where patients had a measurement of their muscle mass at one point. 3 years later, they had another assessment of their muscle mass, and then they looked at the change. And around so halfway in the study, year 2, they asked each individual, all 2,700 of them, how much protein you've been consuming. Okay? And they reported how much protein they've been taking. And these individuals were separated into 5 quintiles. Okay? So you got the high proteins at quintile 5, the lower protein intakes at quintile 1. And there was a nice statistically significant trend where the higher protein consumption group had less change, less decline in their muscle mass assessment. Okay? Those who took less protein had much bigger losses of muscle mass in that 3-year period. Okay? So the lowest one, I think they had about 56 grams of protein a day, and the highest one had about 91 grams of protein a day. So lower protein seems to lead to lower muscle mass. Then this is an important question. So does that mean if I take more protein, my muscle will go up? Okay? Which is the basis for any supplementation studies. If I take more of this, will I get better? Thankfully, the answer is yes. Okay? So, if not, my talk would have just ended there, wouldn't it? Now, so this was a very straightforward study, okay, in terms of what they were trying to determine. So they had 2 groups of individuals, okay? Again, these were robust community dwellers. They were healthy. I think in this particular study, they could walk like half a kilometer. They could go up a flight of stairs. So healthy adults, okay? They had one group that only had 0.8 grams per kilogram per day of protein. The RNI for adults. They had another group that had, well, in this table, it's 2 RDA. They had 1.6 gram per kilogram per day of protein. The recommended one for older adults. Okay? And both had measurements of the muscle mass done. And again, we see greater increments in muscle mass in the group that had protein supplementation. Now, what did they supplement with? It wasn't drinks. They were supplemented with food. So in this study, for 10 weeks, the participants had their meals provided to them. Okay? So the study team would invite them to come. They would collect their food. They would go back to where they live. They would probably at most heat up the food and consume it. So that way they could control how much protein was being consumed. So using I won't say call it normal food, but using just food that we would be able to source readily, increasing the amount of protein consumed, improve muscle mass. So supplementation can work at the right quantity using food. Okay? Now, I've pinched this from the RNI report. It's got how much protein there is in different types of food. But you can Google, and I've done this before, because I've got one of these health monitor things, okay? Because I was trying to lose some of this MCO weight. And you can actually Google how much protein is there in tofu fa, and you will find that answer, okay? So these days, because of the internet, devices like this, we can very easily deduce how much protein we're actually consuming on a daily basis, okay? Similar to this, and if you look at the pack of most foods that you buy from supermarkets, it does say to you how much protein there is in there, okay? This is another supplementation study. Instead of using food that you can purchase, food that you cook, they use protein supplements. Okay, so they use drinks. This was based in Netherlands, and they use a specific Dutch brand of protein supplementation. The supplement consists of about 30 grams of protein in total, and they added it in addition to what participants were taking. And similarly, taking more protein increased muscle mass. Okay? And they took it for about 12 weeks. So I've perhaps just highlighted 2 studies, but we have got a very consistent team that certainly protein intake, total protein intake, certainly makes a difference. What about just oral nutritional supplements then? So we're not talking about protein specifically, we're talking about oral nutritional supplements in general. Now, this is again a clinical trial that was done by our colleagues across the Causeway. Okay, they recruited just over 800 participants, older adults, community dwellers, had to have stable chronic disease, and they randomized them to one group that had the oral nutritional supplement and another group that just had a placebo drink. And this is the study design, 400 in each group. The group in the ONS side had 2 drinks. Each drink consisted of about 260 calories and about 10 grams of protein and about 0.74 grams of HMB. Okay, so you times that times 2, and that's what they had across the day. This is your baseline characteristics. They were in the mid-70s, 45 kilograms in weight in general, slightly more women. They were independent with the activities of daily living. They didn't have many comorbidities. If any, 92.5% of them had a CCI score of 0. And many didn't have any hospital interaction in the last 6 months. So a pretty good group of older community dwellers. And their primary outcome was a composite outcome of survival, readmission, and weight gain. I'm not sure why it says valley, but anyway, I apologize for that. The reference is at the bottom if you want to look at the exact numbers. But from a composite point, a composite outcome, which was their primary outcome, there was a difference, probably all driven by improved weight gain by taking oral nutritional supplement. But what was interesting about this study is one of the secondary outcomes was to look at nutritional status. And the ones who were supplemented certainly had better nutritional status than the ones that didn't supplement. Okay? So we've talked a little bit about protein, we've talked a bit about supplementation. Can we do more to what we are supplementing ourselves or the people we come into contact with? Can we maximize things further? Now, so I've tried to simplify this into one particular slide. Now, we know that there is a dose-dependent effect of protein on muscle, which means the more protein you take, the more muscle you're probably going to build. Okay? Now, protein, after consumption, has about a 30-minute lag before we get to detect any muscle protein synthesis. Okay? So you take it, the first point that we start to detect changes in muscle protein turnover is about half an hour later. And this muscle protein synthesis increases for the next 1.5 hours, 2 hours or so. Then it plateaus off. And then it declines. Okay? Now, however, there is a threshold. There is a ceiling effect, which means that there will come a point where no matter how much muscle how much protein you're going to drink, your muscles are not going to get any bigger. Because that would just be silly. If I just drank protein, I wouldn't expect to have muscles as large as Arnold Schwarzenegger's. Okay? We call this a muscle full effect, that you do hit a ceiling. Okay? And every protein that we take, excess protein is excreted out. Okay. So what does this all mean? It tells us that perhaps how we take our protein is just as important as how much protein we take. Okay? Remember, you eat it, improves muscle protein synthesis, but there's a ceiling effect. Everything more than that, we get rid of. So if I were to take a whole chunk of 90 grams of protein in one go, I'm not going to use all 90 grams because of the ceiling effect. And if we think of our dietary habits, breakfast, lunch, dinner, I gradually increase my protein intake from breakfast, lunch, and dinner, where the most protein I'm going to consume is usually at dinner time. And if you think of this ceiling effect, this muscle full effect, we're probably underutilizing protein synthesis at breakfast because we probably don't take enough protein at breakfast time, but probably underutilizing protein at lunchtime because my lunch just now had only 2 pieces of chicken, and I'm probably going to be over giving myself too much protein at dinner time because that's my biggest meal of the day. So how we take our protein becomes very important to maximize muscle protein synthesis. So we're starting to move towards regular protein loads of about 0.5 to 0.5 grams per kilograms per meal, or about 20 to 30 grams of protein each meal. You space it up, you break it up, and you think about it, this is what athletes do to improve muscle performance. Another way to maximize protein intake is actually with resistance exercise. Okay. Now, exercise vary. We have exercises that improve gait, balance, and also muscle strength. And remember, exercise is very different from being physically active. Just because you walk around your taman doesn't mean you're doing exercise. Okay, that's what I tell my father. So and resistance exercise is an anabolic muscle stimulus. And I know it's not our talk today, but there is good evidence that resistance exercise on its own as a single intervention can improve muscle function. And we've got some emerging data that shows this nice synergistic effect that if you have protein and you have exercise at the same time, accentuates the impact of muscle protein synthesis. Okay, so I'm just going to quote this one particular study where patients were fasted, so they had young and they had old. They were fasted overnight. Then they had to consume a high protein diet in the form of high quality beef. Okay, a big, thick, juicy beef steak. Okay, and then they, using stable radioisotope tracer, they can measure muscle protein synthesis. Okay, so they staff had their big, juicy beef steak meal, measured muscle protein synthesis, and then they saw this increase in protein synthesis. Okay, 60 minutes later, they got them to do some exercise. What exercises did they do? Nothing fancy, just squats. Okay, repeated sets of squats. Okay, and then they measured muscle protein synthesis after that, and that increases that synthesis level by about 50%. Okay, so one thing I perhaps didn't cover in much detail was type of protein. So a question I do get asked quite a bit when I do talks like this is, if you go into any health shops, if you go any pharmacy and you ask for protein supplements, you get various amounts out there, very different brands and very different types of protein constituents. And you might have heard some of these before. Whey, leucine, HMB. Okay, very fashionable, especially HMB. Okay. And the question is one better than the other? And the honest answer is, don't know. Because they've never been compared with each other before. Okay? They've never been put into any form of clinical trial to see if I took HMB instead of this, will I get a better improvement? Okay? So the answer is we still don't know. Is one better than the other? Okay? And I may have just listed 4 here, but there are actually loads of different types of protein supplements out there. Okay? So, summary. Okay? So, muscle health changes in different stages of life. Okay? That trajectory of up and down, fixed. But we can modify the trajectory, how much decline it happens. Sarcopenia is a clinically significant progressive muscle disorder. Malnutrition, including inadequate protein intake, is common among older people. And protein is an essential component of muscle anabolic function. Supplementing protein improves muscle health, but much still remains uncertain about the dose, how much protein, the type of protein, who should be supplemented to get the most benefit, duration of supplementation, is it for a short while, forever, and any particular conditions that may get more protein supplementation effect than others. So that's a very short whistle-stop tour around protein especially and its role in muscle health. That's my contact details up there, and I'm happy to take any questions if time permits. Thank you.
Fantastic. Yes, thank you very much, Dr. Hong, for keeping well within time. Thank you. So we are ready to take questions. Yes, sir, please. I'll tell you what, I'll get that. Sorry, one second.
Okay. Yeah, Dr. Ong. So I just want to ask you, for a vegetarian who are not taking animal protein, are they able to have the same muscle mass on plant-based protein?
Hi. Okay, this is a really good question. Okay. The bottom line is we know that animal protein is better. And the reason it's better is because protein is made up of different essential amino acids. And if we want to have a complete essential amino acid profile in our diet, animal protein is still the easiest way to do it, because different plants have different essential amino acid components. So what it means is you may have to look at your vegetarian diet, or anyone who's vegetarian, or they look at your vegetarian diet and see what is it you're having and whether it's got the essential amino acid component that you require. Okay, so it's not to say not so good or you don't get as much improvement in your muscle mass, but it's about ensuring that what vegetarian food is being consumed would still give you the required essential amino acids. Sometimes we do refer them to dietitians. Sometimes we may recommend supplementation. I know some of the supplements have got plant-based ones instead of animal-based ones. So being vegetarian doesn't mean you are caught short in terms of getting what is required, because at the end of the day there's a sustainability issue, and I know it's probably not part of this talk, but consumption of, sadly, meat and meat-based food is not necessarily a sustainable thing with regards to a bigger global environment picture. So plant-based diet, and it's quite exciting really if you look at the plant-based literature on protein. Yeah. Any other questions?
Dr. Bhaskaran, yes?
Don't need to stand up, okay? I can stand up if you want. Doc, I'm actually, I'm 72. I used to play a lot of games those days, but I used to play political games, so I was away from exercise. So last year I had MRSA. I never got into MRSA. I was admitted in hospital for 50 days. I went to rehab region for 10 days, and I've been going on for about 6 months, 3 times a week, 2 times a week and all that. Finally, I decided that I should do something on my own, so I start dancing. I do dancing every day, 45 minutes. I can dance well, you know. I don't do soft dances, fast dances. Now, despite all that, my muscles are not, I'm a diabetic for 30 years. I don't know, I take good vegetables. Now I'm turning to vegetables, and I take quite a bit of non-vegetarian food 3 times a week. I got all the things, essential fish, mutton and all that. And I take a lot of nuts also, protein nuts and all that. But still I'm not getting the muscle developed. Either it's because of diabetes or what's the problem, I don't understand. I'm trying to find the answer. And still, because one of the complainant is my wife. She said, the way you're walking, you look like a wobbly old man. But when I come to dancing, I can dance, no problem.
Yes, sir.
Oh, if I had a solution to that, I would be a very rich man. How to reverse the aging process. I wish I had an easy answer for you. We've talked about the trajectory just now. We've talked about how things change with time. And unfortunately, nothing we do can reverse certain things. One of the modifiable risk factors I talked about was acute illness. So we know that when there is an acute illness, sometimes there may be a physiological impact on our health, which may not always be reversible. And then it's about maintaining things as they are and preventing things from getting worse. And that would be the aim, that would be the goal, not to restore or return what was happening previously. Now, this is only bearing in mind that we've exhausted all therapeutic options lah. So today we've only talked about nutrition, we've only talked about protein, we've not covered exercise, we've not covered physical activity. But then, from the sounds of it, you're already doing all the right things. So, my advice, which I do say to many of my patients, is if this is where you are, despite doing all those things that you're doing, then I think we need to be grateful, because it could have been worse. We're grateful that you're still able to do the things that you're currently doing, like dancing and spending time at this wonderful conference. And we shouldn't forget that. There's a lot of things that you've done very well, despite 50 days in hospital with a very nasty infection. So focus on the positive is what I always do. And yes, it's a shame we can't get you back to what it was before all this, but there's much to be grateful for. We mustn't forget that. So that's my cop-out answer lah. Yeah, exactly. Keep doing. Imagine if you didn't do any of that. Yeah, imagine you didn't do any of that. Okay, so carry on doing whatever you're doing, because I'm sure they are doing you lots of good, keeping you that level of independence and fitness. Okay, so so this is an interesting question. What about other supplements? Okay, what about other supplements? If you Google supplements, protein, muscle stuff, you get things that come up like polyunsaturated fatty acid. You get zinc, you get selenium, vitamin A, B, C, D, E, K. The list goes on. And there are lots of studies that look at people who take, I came across one recently. If you don't have enough selenium in your diet, you're more likely to have muscle weakness. Zinc similar as well. But what's lacking is supplements. Does taking the supplement make muscles better? And for that, we don't have any evidence that it does. So the role of supplements in this case is uncertain. I don't recommend for it, neither do I recommend against it, because each of you are able to make that decision with your practitioner, your friends, with internet searches, whatever it might be, to see what would work and what wouldn't work. So I think you are going to...
I think, anybody else? Any questions? Yes, sir. Sorry, sir. I think there's a question from the back.
Thanks for the talk. I just want to ask two things. You mentioned that muscle develops and muscle, dies down, the cycle. Out of curiosity, when the muscle dies, how is it excreted out from the system? And then the other thing you mentioned about the weight, and then for older people, you need more protein consumption. There is a threshold, if I'm not wrong. If the protein intake is too much, it hits into the blood sugar, and you gets into the glucagon resistance. Is it true? Thanks.
Thank you. And I think following from that question, I'm sorry, the protein intake could be limited by, say, renal disease as well, right? So I think that's a good question.
Okay, so muscle is an organ. Like any organs, eventually bits of tissue of it will die and regenerate. So that happens within ourselves. Skin tissue dies and new one gets built up. What happens to them? They just get excreted, urine mostly. So they just get excreted. There's waste from our body. Okay. So the question of which I hope I got correct is, if you took too much protein, what would happen? Have I got it correct? Okay. Can you take too much protein? And the answer is actually yes. Okay, but you've got to take a lot of protein for it to cause any significant detrimental effect. Okay, so the simplest way I can go around doing it is just stick to the recommendation. Okay, that 1 gram to 1.5 grams per kilogram per day. Stick to it. You won't go wrong. When it becomes a little bit iffy, where we start to worry about too much protein, it's just like the condition that was mentioned earlier when you've got kidney disorders. Okay, If you have kidney disease, ignore everything I've just said, because you need to see a specialist dietitian to talk about how much protein you should take. Okay? But for the general population, okay, sticking to the recommendation, and if you've got normal kidneys, it would just weed itself out, all the excess protein. Okay.
Thanks, Dr. Ong. I think, do you have time for one more question, please? Yeah? We do have time for one more. Okay, so my question to you is, one more, yeah? Very quickly, can sarcopenia be reversed? Once somebody is diagnosed with sarcopenia, can it be reversed?
I like this question because it's a nice take-home message. Okay, it's a spectrum. Okay, and like any spectrum, you can go forward, you can go backwards. Okay, and the evidence does suggest that we can go backwards with sarcopenia. How much we can go backwards by, that is a big question mark. Okay, so if we did nothing, I have 100% no doubt that it will progress. If you did something, you can stop it from getting worse. And yes, you can reverse it. And we've got studies that show that it can. The effect size is the big question mark. But if you did nothing, yeah, it will get worse. So yes, it's the answer. It is reversible. So start by screening. Start by assessing yourself. You know, finger ring la, calf circumference la, SACAF la, whatever it is la. Ask yourself that question. All right?
Perfect.
Thank you very much. Oh. Okay.
But more than that, I've been taking some immune products for the past 5 years. Will immune, increasing or balancing your immune help you in this kind of situation?
Okay. I will keep this answer brief then, because I see Alan sort of loitering around already, waiting to start the next session. Okay. So sarcopenia, we believe, has a huge inflammatory aspect to it. Okay. So anything that creates an inflammatory environment seems to accelerate sarcopenia. So the role of anti-inflammatories and antioxidants is an interesting one. There are some studies that are being developed to look into whether it makes a difference or not. I know of one that was published recently that wasn't very successful. So I think watch this space. Because we know that with sarcopenia, there's a huge immune modulating effect, and whether if we can do something about that, could it be a viable treatment? So yeah, watch this space. Okay, thank you.
All right, thank you very much. Thanks, fantastic. Thanks.